Thank you, Dr. Dart. First, before I begin on the COVID, I just want to thank everyone who in the last and sent me emails or on social media or approaching me out in the community saying, you need to make everyone wear a mask. And I don't know of any public health professional that I've talked with or a health professional, a doctor, a hospital leader who doesn't believe people should be wearing masks. The challenge for us from a city government standpoint on this, and the reason that we don't just run out and do it, is that if you put an order in, you have to enforce it. It's not just a helpful suggestion if you're putting in a mandate. And regulating that would be a tremendous responsibility for our local law enforcement agencies. You think about what we went through in the early going of this pandemic, where we shut down bars and had restaurants shifting over to carry out only. Well, in that universe of companies, you might be talking about maybe a couple thousand at most that the police are having to check on and follow up on leads on. When you talk about when we did our overall safer at home approach, or when the governor put his order in, but he exempted so many businesses as essential businesses, still, you're talking about maybe several thousand entities in our metro area that had to be tracked and monitored. With an order like this, you're talking about 1 million people in a metro area that may not even live in Tulsa but work in Tulsa, that come through here, that have to be monitored and followed up on. And so that, when I talk with our hospital leadership, when I talk with Dr. Dart, I think the concern that I've heard is not that people think, oh no, people don't need to be wearing masks yet. I haven't heard anybody say that. It's that we need to make sure that if we are going to put that kind of a massive responsibility on local law enforcement, then we need to be at a point where we have no other choice than to do that. On that note, we've talked a lot throughout our reopening plan about different data metrics that we're tracking. In the early going, we talked a lot about positive case rates. The state's primary metric that it's used throughout the reopening process has been hospitalizations. The good news is that our overall hospital capacity in Tulsa remains strong. But I will tell you, I check in routinely with the leaders of our hospitals here in Tulsa, and throughout the reopening process, what I've heard in nearly all of those is, Mayor, we have capacity, we're doing fine, things are fine. It was this week that I finally started to hear some concern, not about where things stand today, but where things could look if we continue on this trajectory unchecked.